Yes, there is a lot of confusion around PSA screening, which is screening for prostate-specific antigen in a patient's blood. What patients need to understand is that PSA screening or the PSA test is not a cancer test. It is more of a smoke alarm for the prostate. It can indicate several things that might be going wrong in a man's prostate. It could be an infection that could be taken care of and treated with antibiotics. It could be simple enlargement of the prostate, which occurs in many men as they age up. It could also be an indicator that there might be the presence of cancer growing in the prostate. So it is the first tool or the first step of a diagnostic process for cancer, number one. Secondly, if after analyzing prostate scores, or PSA scores, if you will, let's say year over year, and you see a rise, it will depend upon the PSA numbers. Generally, the threshold for a physician to recommend a biopsy is a PSA score of 4. Now, I'll use myself as an example here. Having had annual PSA tests since I was 40 and a DRE with my annual exam, my PSA went from 3.1 to 5.8 in a year's time. That's nearly doubling. That's an acceleration of PSA that signals something might be going on here beyond just enlargement. So in consultation, I made an informed decision with my urologist to undergo a biopsy. And then those scores came back and it indicated that, yes, indeed, I did have cancer. The Gleason scores, which is something a patient has to understand, mine was 7, made of 3 plus 4s, which is more aggressive than 4 plus 3s, which is more aggressive than 3 plus 4s. It was in 50% of my prostate in terms of involvement. So looking at those numbers, we then, once again, made an informed decision based upon the facts and the data that we had that I would proceed to having a radical prostatectomy. So the PSA is not an end-all. It's one step in a diagnostic process for cancer, and it is to date the best tool we have. And patients need to understand that more fully.